Hi, I'm Mickey Rose from Pure Health Clinic. Thanks for watching. I hope you enjoyed my first video where I introduced you to the Doctors Data GI360. Had some lovely comments, thank you very much. Today I'm recording from my spare bedroom in my flat by the sea. I wanted to be able to show you the sea, but unfortunately it makes me look like I'm in a silhouette, so I couldn't do that. So forgive the bed behind me, and if I move, hang on, let's see, can you see the cat? Is she still there? Oh, almost. You can just see the top of her, look. Anyway, today I thought, okay, you've done your Doctors Data GI360 and you've got this whole report back with lots of different results and things, and you want to know what the heck to do with them. So I thought it might be useful if I went through 3 test results that came into clinic, so real results, and show you how I might interpret them. I hope it helps for you. I've seen thousands of patients over the years as a natural health consultant, and now I've stopped clinic work for a bit. I want to pass the hopefully really life-changing information over to you. If you're new here, click the subscribe and the like buttons and help me keep this channel going. Thank you. As I go through things, I'll pop links below for you, and if you have any questions, pop them in the comments below and I'll get to them as I can. Okay, hope you enjoy it. Let's get to it. So I'm going to take you through 3 different sets of results today, so hopefully you'll find something that resonates with you. They're all quite different and show a different picture, so that might be quite useful. Before I start, just a couple of tips. Don't forget to watch the first video because I went through quite a lot on the markers throughout that one, so that will give you some hints and tips as well. I'll pop a link to that below. Also, this video is based on the Doctors Data GI360 because that's my favourite one, but a lot of the markers show up in quite a few of the gut tests. So if you're trying to interpret, say, something like a GI map or a GI effects or even the Doctors Data CSAP3 or whatever, it should help you with those too. I realised as I was going through this that it's actually really quite complex. Of course, I find it quite easy because I'm doing it all the time, but some of the comments that came back from you said on the first one that it was pretty complex. So I tried writing a 1-pager crib sheet for you, and somehow it morphed into a 25-page fact sheet on how to interpret gut test results. So I've popped that in the shop for you at very low cost, and I'll pop a link to that below for you. Just takes you through how I would see each marker basically, so hopefully you'll find that helpful. You don't have to remember everything on here then. And just lastly, a very important reminder, remember that test results are just a snapshot in time, and also they should always be taken in context with the rest of your case. So do please discuss them with your practitioner. Just because something shows up doesn't mean to say you've got the problem. So you need to take them in context with things like your symptoms and your case history. Okay, I hope that all makes sense. So let's get started with the first test results. Hope you find it useful. So here's the first set of results for you. This is a person in their mid-40s. By the way, I'm not got my little box on for you today because I didn't want to block off some of the screen, because I noticed last time that you couldn't see some of the things I was pointing at, so apologies about that. Anyway, let's get on with it. So you can instantly see from this particular page that this person's microbiome is likely not to be the problem, because she's bang on normal, which normal is a score of 2. You can see up here with the spidergram here that okay, she's not totally in balance with certain ones, but it's not bad compared to the European normal microbiome that's actually compared to. Okay, so we can see her dysbiosis score is 2, so I'm already thinking, okay, well, I don't think there's going to be a particular issue here. So let's just have a look at the key findings here then. So this is the first thing I always look at, and as predicted, nothing much going on over here. There's a few low bacteria. Here I might be looking to see, is there an infection, or is there something that I'm particularly looking for that might be low, and it isn't. So instead I'm going to look over here where we've actually got quite a few different things that I normally look for. So I'm automatically thinking, okay, so this person's got low elastase, they're not digesting food down very well, they've probably got a leaky gut because the butyrate is low, their short chain fatty acids are low, which means they're not regulating their immune system very well. And importantly, we've got occult blood detected, which is a red flag symptom. And it may well be that she has to report that to her GP and get some more diagnostics on that. So I'm already thinking this person has probably got a problem with food intolerance. So that's what I'd immediately look. As I'm going through the rest of the report, what I'm looking to see is, can we see any reasons for that? So, for example, are the butyrate producers in the microbiome particularly low? Well, we can't see any over here necessarily, but that's why interpretation is quite important, because algorithms don't always pick things up. Okay. This is the first page of the report where we're starting to look at the microbiome in real depth. As I said in my first video, I don't tend to look a great deal at these individual bacteria. A lot of this is done for research, and I'm sure at some point we'll find out what these are all about. But we know a few of them, and I try to look at those. But in general, I'm looking really at the overall picture, which we've seen on the dysbiosis score, which is pretty okay. So we're looking at anything in the green, so you can see here within the reference interval is okay. So I'm looking particularly at the beneficial bacteria here. So bifido is one of them. That's one of the main beneficial bacteria to keep inflammation under control and generally help the body in terms of healing. And you can see it's not been picked up as a key finding, but the reference is -1 to +1, and we're only just into -1 here, so I would say that's a little bit low, and that could be one reason why the butyrate is a little bit low, because even though bifido doesn't encourage butyrate production itself, it does encourage other bacteria that do produce butyrate, if that makes any sense. Okay, so just moving on a little bit. So I don't see anything else. The bacteroids are quite high there, which might play into why her propionate is quite high on that. Let's have a look. What else have we got? Some of the ones that were picked up on the key findings are low. Incidentally, you can there's a really good Doctors Data GI360 interpretation report, which I will include in the fact sheet that I've done for you as an extra bonus. So you can always look any of these up and it will give you an idea of what they mean. And Dr. Google, of course, will help you with that as well. Moving through the next page, we've got this one again, which is not one I particularly am aware of, which is borderline low. Lactobacillus is what the other, along with bifido, is the other really major bacterium that's really beneficial for your health, and that seems okay, so that's not too bad. Just picking up this one here, the Parasites, this is one of the main butyrate producers, and again, not been picked up on the algorithm, but this is -1 to +1 again, and we're only just into -1 there, so I'd say that's on the lower side. So that could be one of the ones that is not producing very much not producing very much butyrate. My cat has just gone up on my leg, which is why I was pausing there. Sorry about that. I never work with pets. Anyway, so that's the Parasitio, which does produce butyrate and is on the lower side, and the bifido that we saw earlier that was a little bit low. By taking lots of bifido, you can probably improve that Parasitio level, which will help with the butyrate. Okay, so moving forward. On the next page here, the proteobacteria is on the higher normal side. That normally is because somebody's having a high protein diet or not digesting it down very well. And they are quite pro-inflammatory, so you don't really want to see that any higher than that. This is okay, but I'm just noticing it, that's all. And Akkermansia, which is another one of the ones that I look at, is important because it produces mucus. And usually if that's too high, it suggests that the body's having to produce mucus to protect you against something, or if it's low, it may well be that you're vulnerable to a leaky gut because you're not producing enough to protect the gut lining. Sorry if you just heard my cat meow there. She wanted to be let out, so I've just gone and done that. Okay, on this next page, we can see everything's negative, thank goodness. This is where we're looking for viruses, the pathogenic bacteria, and starting to look at the parasites. Continuing on the next page, nothing found, so that's really good. By the way, I can't scroll through, which is why I'm doing it page by page, because I don't want you to see, obviously, any confidential information here, so hence why it's a little bit disjointed, so I apologise for that. Okay, so we're on the next page now. Again, no roundworms are okay. So the first thing we're looking at here, which has been found, is white blood cells. So I immediately think, okay, why is this person producing white blood cells in the gut that are detectable? It's not many, it's few, but even so it's there. So that would immediately make me think that they are reacting to something, or there's an infection going on, or there's some inflammation. So I just always bear that one in mind. It's a snapshot. Excuse me. It's a snapshot, remember, so it may well be that if you looked at that again in a month's time, that wouldn't be there, but we're noting it now. There's no muscle fibres or anything like that. We're no red blood cells, that's good. Colour is brown, consistency is soft, and there's no mucus, so nothing too major there. Here we are now looking for the pathogenic bacteria. Thankfully, no growth of anything there. There is a strep which is trying it on. It's not a dysbiotic one. It's what I call an opportunist. So often you'll find that if, say, Bifido or Acidophilus or one of the most important beneficial bacteria are low, then you might get what I call a trier on, and they're usually streps, to be honest. So again, that it's not major at the moment, but it is 3+. So doing something to help that health of the gut generally will probably get rid of that. And there's no growth of yeast isolated here either, so that's good. This is where it starts to get interesting, really. This is my favourite page. This is the stool chemistry rather than the microbiome side of things. And I'm looking for lots of different clues here to different things that are going on. So elastase is whether we're producing enough digestive enzymes or not. And we've got a borderline low here. Now, here the reference interval is more than 200, so 134 doesn't seem that bad, but actually what we've found in clinical practice, and a lot of practitioners say the same thing, is that we really prefer this to be up to about 450, 500. So anything sort of lower than that could still need some extra support in terms of some enzymes. So this person is probably not breaking down foods very well. And I would probably suggest that they had some digestive enzyme support. Also, just to point out, you can't test it on this test, but usually if I find elastase is low, I want them to check stomach acid levels as well. And I find low stomach acids really, really commonly. There's a fact sheet on the website which is all about stomach acid, so I'll pop a link to that below for you. But check that out and make sure that your stomach acid is high enough, as well as your digestive enzymes. When we're talking about gut results, basically, or gut treatment, I suppose, there's a sort of hierarchy of what you sort out first, and digestive enzymes and acid is always number one. So if you didn't do anything else with these results, we've got a clue here that that person needs to digest their food down, and that becomes important when we're talking about food intolerance, and we'll look at that in a bit more depth in a minute. Okay, moving on to fat stain here. This is okay. There's none showing, so we're okay. Just a little point of reference here, and all these kinds of tips are in that fact sheet for you that I've written, because I know you'll never remember them, and neither do I, so I like to have things written down as well. But if, say, this is on the lower side, which this is, it would make me think that that person's either got probably got a low-fat diet, probably not eating very much. If it was high, then it would be that that person's not breaking down the fat very well. So it may be that her digestive enzymes aren't necessarily needing lots of lipase, but which is the thing that breaks down fat, but she may need a broad spectrum digestive enzyme, which is what I would normally give anyway. In the fact sheet that I've written for you, I've given you specific products and protocol suggestions for each of these markers, so I won't bother going through the whole thing because it will take me about 3 hours, but trust me, it's there for you. So if yours turns up as low elastase, you think, what the heck is she talking about with a broad spectrum digestive enzyme, there's one in there for you to try. Obviously I haven't got your case, so these are only suggestions, and you must discuss it with your chosen health practitioners who've got your case. Okay, so that's the digestion and absorption side of things. Nothing too major, but definitely needs more help in terms of digesting things. What we don't want is things not being digested down, because then you've got things in the small and large intestine, which is like food for bacteria or yeasts or other things in the microbiomes that you don't really want there. But also it means that you're not breaking down foods very well. So you've got sort of chains of amino acids which the body doesn't recognize, and that's part of the reason why people start reacting to foods, which is why I always look at that first to see if there's any kind of food intolerance or sensitivity issue going on. Okay, moving down a bit, we're on the inflammation here. Now happily this is all in the green, so that's absolutely fine. In the fact sheet I've given you the numbers I would look for on calprotectin and what they mean particularly, and what the differences are. So lactoferrin is usually helpful to identify an inflammatory bowel disease, so that might be something like Crohn's or colitis or something like that, whereas lysozyme helps you to identify whether it's likely to be more of an IBS rather than an IBD, inflammatory bowel disorder problem. Calprotectin is just a brilliant all-round inflammation marker, and the levels of that can give you a bit of a clue about what kind of thing you're dealing with. But if any of those are high, obviously you take anti-inflammatory action. Immunology, secretory IgA, one of my most favourite markers. Basically, it tells you an awful lot, and people don't really understand about it very much. On this one, we've got, it's only just into normal. Look, I would prefer it to be way up to about 160 plus or something like that. If it's low, what's happening is you've got not enough IgA to either tag foods as safe. So IgA is the first thing that tags a food as safe, so that your body knows that it's a perfectly safe thing and there's no need to react to it. So you can imagine if you haven't got very much IgA, SIgA, then you may well be coming back up to this elastase. You may well be coming across these chains of amino acids that haven't been broken down, and you're not got enough IgA, SIgA, and so you're not tagging it as safe. And so, boom, off we go with some kind of immune reaction, which could be where that white blood cell level is coming from. Something's happening there. May not be anything to do with it, but there you go. I'll just mention it in case. So, and the other point with SIgA is that it's your first mucosal defense system, if you like. So along comes an infection or a baddie of some kind, and it should be tagged by the SIgA as something that needs attention. And so you can see it's not a good idea to have low SIgA, because it makes you more likely to have either food intolerances or not be able to fight infections off. And I often find people who have low SIgA who've had chronic candida or chronic infection that they can't seem to get rid of no matter what they do, and it's because their SIgA is too low. So you can boost that quite simply if you use the SIgA boosting protocol in the candida plan or the gut plan, and I've mentioned it in the fact sheet as well for you. That will help to bring it up. But it's really important if you've got something chronic going on, like food intolerances or infections, that you check that SIgA and you correct it. If your SIgA is high, which it isn't in this case, but if it was high, that suggests that you're actively fighting something and there's some kind of inflammatory reaction going on. So it's almost like an inflammatory marker as well as immune, really. That's why I like it so much. And there's a page on the website on purehealthclinic.co.uk where I go through a lot more detail about SIgA, so that should help you too. All right, moving on to the short chain fatty acids. So what I'm instantly looking for here is what's the butyrate up to, because that's the most important one. So butyrate is the food, if you like, it gives energy to the cell walls in the gut. So if somebody's got low butyrate, which there is in this case, then it may well be that they are much more likely to be having a leaky gut. And it also means that their short chain fatty acids in this case are low, and that's important because the short chain fatty acids are also responsible for controlling your Treg cell levels, and it's your Treg cells which are controlling or regulating, if you like, your immune response, and that's poor. So if we looked at this particular case, this is why I chose it for you, because it's actually really a common picture. So somebody comes in with, I don't know, IBS type things or chronic pain of some kind or whatever it might be, but something's been going on for a while. I automatically thinking, I wonder if they're responding to foods like gluten or dairy or grains or whatever it might be. So one of the things I might suggest is that we had an allergy test, but I'd also want to know why, especially if that allergy test or intolerance test has come back positive. So with this case, you can see this person's not breaking down foods very well, so they've got some going into the gut that the SIGA doesn't recognise. They haven't got enough to tag it as safe, and so therefore you're more likely to react to it. And then we've got low butyrate, which suggests that those proteins will be going through into the system and causing inflammation and problems, and we can't control that reaction very well because we have got low short chain fatty acids and therefore not as effective Treg system as we should have. So does that make sense? So you can see why that person might be suffering from food intolerance problems, and instead of just saying, oh, okay, cut all those foods out, what you need to do is to work on these issues. So you need to make sure that the digestive enzymes are higher, and think about why that might not be. You need to get the SIGA level up, you need to get the butyrate up, and you will pull the short chain fatty acids up as well. And again, in that fact sheet that I've written, I've given you what I would say in a clinical protocol on how to deal with all of that. Interestingly, we've got I can never say this word, propionate. I only ever read them, I very rarely say them out loud. And I also never see this very high, but I did check it out actually because I was interested. And I remember it was to do with one of the bacteria, I think it was a bacteroids or something higher, which tend to produce this, so which is why that's high. But despite that being high, the short chain fatty acids are low anyway, so it doesn't really matter necessarily. But if, say, that was the only thing that was there, you need to look up in the Doctors Data interpretation report maybe, or Dr. Google about what you do about bringing that particular bacteria down. Okay, so does that all make sense? I know it's a bit complicated, which is why I started writing it down for you. Okay, last bit we've got here, we've got the intestinal health markers. The pH is too high here, only just, so I'm not overly concerned about it. It's 7.8, which would suggest that that person is far too alkaline, which means that when something's going in to the system, it's not being broken down as effectively as it might be. And that could be a food, but it could also be like a baddie, like a candida or something like that. So you need an acidic gut environment to be able to kill stuff off before it gets into the small intestine and the lower intestine. So we haven't got any infections showing, but that's a vulnerable gut there basically. And it may well be because that bifido and some of the other more acid producing bacteria are low. So by correcting some of the gut things, which is what we've talked about in the fact sheet, that may well correct itself. Beta-glucuronidase is fine. That's basically if somebody wasn't breaking down toxins very well, and that can be a reason why people have high circulating estrogens. Again, I've talked about that some more because it doesn't turn up in any of the test results in the report for you. Occult blood, we've already said that's a red flag, and so that person was asked to go and see their GP and to get some more diagnostics. It could be that it's absolutely nothing that's a problem, but it's likely that it might be something like bleeding from above. That might be in the stomach, like a gastric ulcer, or it could be somewhere in the gut, which tends to be higher, so it'd be the small intestine or the stomach, where there might be a problem there. So that needs investigating. And what I would normally say is do a double check. Is it still there? And then make sure you get some more diagnostics. Could be nothing, but it is a red flag for things like bowel cancer, so it has to be flagged up. Okay. The rest of this particular report is just the analysis from the lab, which is all really useful actually, so do read those through properly and gives you lots of information. But that's the first set of results for you, and I hope you followed. That was the most complicated one, so don't panic. Okay, and so I'm just going to switch now to the next one. So here we've got the second set of results, entirely different this one. This is much more a younger person who has got an inflammatory bowel disease from the looks of it. That's what I'd take from here. First thing we can see is that she's slightly out on the microbiome here, and you can see that the deficiency is coming from the firmicutes there. Which you'll see in the report further down. It tells you which ones are the firmicutes, so that might give you some additional information about how to correct it. So let's go to the key findings. You can see there's a lot more going on here, look, can't you? So you're just looking at some that are very high, some that are very low, and that might give you some clues about what might be happening if you look at the report and what each of those bacteria mean. But over here is more interesting for me. I'm thinking, okay, this person's got some salmonella. I wonder if that's an active infection. White blood cells are abnormal, so there is some kind of infection going on. The stool isn't particularly brilliant in terms of its status. There are a couple of infections here, Citrobacter, Morganella and Candida. And then looking at the lactoferrin is very high, the lysozyme is very high, and the SRJ is very high. That is a picture of probably an inflammatory bowel disease. And I would automatically be thinking, are any of these infections, including the salmonella, playing into why this person has got, or has having flares at least, for an inflammatory bowel disease? So that's what I immediately pick up from here. Are there any problems from over here or problems from here that might be causing that inflammatory reaction? Okay. So looking at the first page here, I'm not going to go through the whole of the microbiome here because we did that in the first one and you've got the picture there. But essentially we're looking at these things that are borderline, and then we've got some that are high as well. So I think what I'd be doing here, you can't possibly know about each individual one. It would be, keeping all that in your head. So you'd look up each one of these and see what it mentioned, to see if it had any particular affinity for causing inflammation or something like that, and then do something about it. Here we are with the firmicutes. You remember when we looked at the spidergram at the start, we noticed that this was the class that was particularly low, so it's worth looking here to see which ones are low. Clostridia, people always think is they should have that low. Some of them are beneficial for you and some of them clearly aren't, but overall this is low here. And we've got some of the eubacterium, which are anti-inflammatory, which are low. We've got the Prasnitzii here, which is the butyrate producer, which is low. So there's some reasons there why the bacteria particular picture might not be helping this particular person. Here's the pathogens page, the start of the pathogens, and we can already spot here, this is where the salmonella has come up positive there. So I'd immediately be thinking, okay, what if that salmonella's got any, I don't know, autoimmune cross reactions or some kind of effect on bowel disorders or inflammation in general, and I'd be doing something to bring that down if I could find any evidence of that. Here's the start of the stool chemistry markers. So we've got a few yeast detected here, and we've got some white blood cells, many, which we picked up before. So there's clearly some kind of immune reaction going on there, probably against those pathogens that we've found. and it's loose and watery here. So again, it's not she's not forming the stool particularly brilliantly. So thinking about why those white blood cells might be up and she's fighting something, and why the SIGA might be up, because that can be a sign that somebody's fighting an infection. We're looking at the pathogenic bacteria here. We can see that there's some imbalances with the hangers-on, or triers-on as I call them, but we've also got some dysbiotic bacteria at quite high levels, 4+. I find this quite often, so it is worth checking on that one. So we've definitely got a Citrobacter, which I see quite often. Morganella I don't see as often. And again, what you would do, we've got Candida as a 1+, so we've got yeast found earlier as well. I'd be making sure that this person did some kind of gut infection protocol which included yeast. So you would check to see in the interpretation report for the different bacteria and my fact sheet where I've talked about some of them, to see precisely what the mechanism is there and what you do about them. And we should have below in the report some idea of what kind of natural and antibiotics might kill them off. Continuing with the stool chemistry here, we've got our elastase here at 452. Yay! I rarely see that actually. So this person is actually digesting their food down. I think it's because I see so many food sensitivity patients, or was doing, that I often see that low. So it's unusual for me to see that as good. Fat is okay, carbohydrates are okay. So we've not particularly got any digestion absorption issues there. But this is where the issue is. Look, lactoferrin is very high, 78.8, and we've got lysozyme, which is much too high as well. Calprotectin isn't. So we're looking here that generally speaking, if lactoferrin is high, then you would suggest that person has some kind of inflammatory bowel disease, and which might be colitis or Crohn's or celiac disease even, and you ask them to go and get some more diagnostics done through their GP and report that. If you've got lysozyme and lactoferrin isn't low, then generally speaking you're looking at much more likely to be an IBS type problem rather than an IBD type problem. If you've got both of them high, that pretty much suggests that there's an inflammatory bowel disorder going on. Interestingly, calprotectin is low here, and that's why they do the several markers. A lot of the tests only do calprotectin or one or more of these, but I find the fact that you've got 3 on this particular test very useful, and that's why it's one of my favourite tests. We've got SIGA here, which is high rather than low, as it was in the last test. High usually suggests some form of fighting going on. They're actively fighting something, which we know there's several infections going on, so it's likely that. And it's also a marker of inflammation. So if somebody's fighting something, there's usually inflammation going on at the same time. Okay, this person, it generally looks okay, but if you look at the butyrate, it's only just over, look, 0.8. So it's 1.3, and the total is only just in normal as well as 6. So I personally, even though that's not been picked up as a particular issue, I would personally be making sure that we pulled up those short chain fatty acids, because we want that person to not have a leaky gut, and also to make sure that they're regulating their immune responses, especially with something like an IBD going on, and we want to make sure that that's nice and healthy, and I would prefer to see that up sort of past 10. Really, it's okay. Some people would say that that's not a problem at all, but if you're looking outside the box and you're looking at the actual case, which is why it's important to discuss these with the people who've got your case, because you put them into context with what's going on with that particular individual person, and you can make a lot more sense about these particular markers. That makes sense. Yeah, and everything else is okay there. So here we've got one of my favourite parts of this particular report, and you don't get this very often, is that what in vitro at least has helped this the different dysbiotic bacterial pathogens that we have been found in the report. So this one's Citrobacter freundii, and we can see here that if this person used oregano, which is in an awful lot of protocols, it's not going to do a fat lot, but actually if they went for uva ursi and grapefruit seed extract and silver, as a combination or just the Uvarursea on its own, they're more likely to kill this Citrobacter off. They could go the antibiotic route, and again you can see here it's resistant to those, so it would be no good using them, but it may well respond to these ones. And it's perfectly viable. This person's got an inflammatory bowel disorder. They need to get that under control quickly, so it would be perfectly a viable thing for them to do what they need to do in terms of antibiotics. I'm not against antibiotics. I just want to make sure that that gut is repaired after them, if you know what I mean. So you would take a really good protocol to repair that gut and bring the microbiome back up again. Similarly with the Morganelli, you can see that the top one is Uvarursea again, and some of the same antibiotics here. So you should be able to collar both of them at the same time. For the Candida, it's a similar story. Where have we got? Yeah, Uvarursea turns up again. So again, there we go. And this time we might add in some plant tannins and some caprylic acid, which might get rid of that as well. But they could use nystatin if they particularly wanted to, or some antifungals here, which might work as well. So the rest of the report is the interpretation from the lab again. So again, read that. Really, really useful stuff there. So that particular person we saw had probably infection related inflammatory bowel disorders. Now, it's not to say that the infections or anything that turned up is actually causing the IBD, but it's not going to be helping in terms of the way that that person is able to heal, because it's got other stuff going on, and we need to make sure that they haven't got a leaky gut and that their Treg cell production from the short-chain fatty acids is much better than it is as well, and that would generally help. So I might suggest that they did some form of protocol like the Candida plan, but making sure that their inflammation is down. So I'd be suggesting anti-inflammatories, and I've gone through that, and my favourite one's in the fact sheet for you, so that should help. Here we are now with the third set of results then. So this one is a different one entirely, because this is much more about an upset gut, and what I suspect would probably be IBS type symptoms like wind and bloating, and much more IBS than IBD, which is what the last one was. So we can see immediately from the spidergram here that it's all a bit out of kilter, got deficiencies in quite a few there, and the proteobacteria is the higher one, and that tends to be inflammatory. We can see the dysbiosis score here is 4, so 2 is your normal over here, so you can, and it only goes up to 5. So basically you can see that this person's microbiome is a little bit upset, so you'd probably be focusing on how to balance that a little bit more. So let's look at our key findings here. Oh, quite a few going on. So again, as I've just said, the proteobacteria is high. You'd look at through these and see if there's any clues here. So the bifidobacterium is low, the Prausnitzii is low, so the butyrate's bound to be on the lower side, or short-chain fatty acids is not brilliant. And again, look here, we've got several. We've got 2 parasites. You often find blastocystis and giantamoeba in infections together, and they have been related to IBS. So that's why I'm suspecting this person may well have IBS type issues. We've got bacterial infection here, and we've got some Candida as well. The person's not producing very much elastase, so not breaking things down very well, and this is the crucial bit here. The SIGA is very low, so this person is very unlikely to be able to get rid of these without pulling that SIGA up, if that makes any sense. So we talked about that before in the first test results. So let's have a look through. So here's where we found the blastocystis and the giantamoeba that we saw on the key findings. So they're both found. So blastocystis is moderate and only rare for giantamoeba. Blastocystis, again, if you look at the report that I've written, I've talked a little bit about these, but the blastocystis is there's a bit sort of debate going on about whether they're or not. So this is why you have to take results in context with the person's symptoms and case history. So if this person had sort of IBS type symptoms, then I would be thinking, okay, it's worth treating the blasto. If it turns up with dientomoeba, I think it's definitely worth treating. But if that person hasn't got any gut symptoms whatsoever, it may well be that they're carriers or they're asymptomatic, which you do get. So just bear that one in mind. Here we can see we're looking at the pathogenic bacteria and dysbiosis specifically. So you can see this is where we pick up the Enterobacter, which is at 3+. So it's not major, but it's growing more than it should be. And we've got low levels of candidas here on that one. So it's not too bad at 1+, but there are 2 of them. Here we are on the stool chemistry, my favourite page as usual. So we can see this person's elastase is too low, so they're not breaking things down. That's 90, which is pretty low. So remember I said I'd prefer to see it over 450 to 500 here. So that person's not breaking things down very well. So I would increase that. So some of this person, if they did have IBS type symptoms, is likely to be food intolerance because they're not breaking things down, and also we know their SIGA is low, so they're not going to be tagging foods as safe either. Let's have a look at the short chain fatty acids. Yeah, 8.3 in normal, but again I prefer it to about 10+ really, so we're not regulating the T cell reaction down very well, and the butyrate is 0.97, only just over normal. So that person could well be having a leaky gut. So there's probably a bit of not breaking down foods, not tagging them as safe, a bit of food intolerance cause going on here as well. So that's a bit like we discussed in the first set of results there. No inflammation going on, so that tells me that it's not an IBD or there's no actual active inflammation that we're aware of. So I would say, let's have a look down here, we've got pH is a little bit too high. That's because of the acidifying bacteria not being at brilliant levels, probably in the microbiome. So a general overall gut MOT would probably be a good thing for this person, and the key would be to bring that SIGA back up and make sure that they have got enough digestive enzymes and stomach acid, as we've talked about before. So for this particular person, these results, I was interested to show you that this person's got infections going on, and part of how to get rid of chronic infections that you're not getting rid of very well, albeit at not massive levels, but it might not be helping, is to get the SIGA up. And if the SIGA comes up, that is also going to help in terms of tagging foods as safe. So if there's any kind of food intolerances going on, that should actually help there as well. So I'd likely give this person the gut plan and make sure that they pull the SIGA up as a part of that, and check their stomach acid to make sure they're actually breaking things down in the stomach as well as via the pancreas. Okay, so I hope that makes sense. Here we are on the page where we find out what we might use to kill these baddies off. Interesting, this time instead of uva ursi being the biggest one, we've actually got grapefruit seed extract, which is actually what the Candida plan is based on, which turns up an awful lot in these charts, which is why I changed from oregano to grapefruit seed extract as the main killer. But generally speaking, what I find is, and I've talked about this in the I think I've talked about this in the fact sheet, is that if you can combine several together, so in this case it might be oregano and grapefruit seed extract or silver, or you can rotate them every few days, because I've found in clinical practice that it's actually more effective to get people to rotate the killers, as I call them, so that the bacteria or pathogens don't get used to it, and I tend to find that it's a lot more effective that way, as is combining different things. So for example, the Candida plan is based on grapefruit seed extract, and you might add some silver into stage 2 of that, which is the killing sort of stage. There are preparation stages to make sure that your liver and system is ready to kill stuff off, so you don't feel so crap when you're doing it. Okay. This just proves my point on the grapefruit seed extract again. We're looking at the candidas here. So grapefruit seed extract way above anything else in terms of likely to kill it off. And this candida is also grapefruit seed extract, but uva ursi. So that's where you might combine that with your grapefruit seed extract to help kill it off. Okay, so this person probably likely got infections that they can't kill off because the SIGA is too low. So that would be the key for that person to feel much better. I would give them a general MOT, really, the gut plan or the candida plan, preferably. Okay, so I hope you found that helpful. You can tell that it's gone all dark now. It's taken me all afternoon to do that. So that's why the lighting looks a bit strange. But I thought I'd finish off today. If you've got any questions, please put them below and I'll answer them there, or I'll do a Q&A video if I need to at some point. Please subscribe to the channel if you found this really helpful. Share it so other people can find it and like it. It helps me to keep this channel going if you do that for me. I'll pop any links below, so to the fact sheet, any of the pages that I've mentioned, or anything that I think that might help you, so do check those below, and I'll catch you on the next video. So thanks for listening.